Hi, this is Dr. Rich Webster, and we are starting to do these videos on different orthodontic topics. And this is our first video. I'm really excited to do these videos. The first topic I've decided to discuss is about oral hygiene, which is very important. Before we focus on moving teeth and making and correcting bites, we always want to make sure at every appointment that the hygiene of patients is good and that it's being maintained. And through my experience, and actually being a patient too, that was actually me with my headgear, picture of that when I was a patient. Through my dealing with my patients, my experience, and also just being an orthodontic patient, I found these tips to be very helpful to have good oral hygiene consistently and predictably. The first suggestion is to still, always go to the dentist at least twice a year for your cleanings and checkups. And a lot of times with braces, if a patient's in braces, they may want to go to the dentist even more regularly than twice a year, sometimes 3 or 4 times a year, just because it's harder to clean the teeth with braces on. An Invisalign patient doesn't have as many struggles with hygiene usually because they don't have the braces in the way. But definitely still going to your dental appointments is pivotal to good oral hygiene. On a daily basis, what I recommend to my patients and when I had braces is to brush after every meal, including breakfast, lunch, and dinner. And usually the patients want to do that because half their meal is still in their mouth. So aesthetically, they want to clean it out just so they don't, when they smile, they don't look like they have all their food in their mouth still. And so doing that, and then at night, they need to do 3 things consistently. And this kind of defines if the patient is really serious about oral hygiene or if their hygiene is going to be good, because it involves the hardest part of the hygiene process. And those 3 things at night before they go to bed, the first is they need to floss in between each tooth. And that is the hardest thing because the braces are in the way, and they usually need to either use super floss, which is it's a different glorified kind of floss that's easier to thread through the wires, or they need to use floss threaders with their floss. And that takes some effort, and it takes a little bit more time. It's not as easy as normal flossing because they have to go around the braces and the wires. When I was learning how to do that, the first time I did it took me 10 minutes, and I had to look in the mirror, and it was frustrating. But as I consistently did it every night, I found that it became a lot easier, and I could do it while I was watching TV, and it took me less than a minute because I was used to doing it. And again, so that's the hardest thing for patients to do is flossing. And flossing is really important because it cleans the gums out, gets all the food that brushing cannot reach. Some people ask me about a water pick. Those can be used. They're not as effective as flossing, in my opinion, because the water cannot get all the way down underneath the gums like flossing can. But they're definitely a good complementary thing to add for hygiene purposes. And so that's the first thing is flossing at night. And then after flossing, using a Listerine rinse or an Act rinse. Those are 2 types that I find are very effective. Some of the other rinses are a little bit weaker, and they're usually they're a little bit less expensive because of that. But the Listerine and Act I have found to be very effective, and they need to have that in their mouth and gurgle it around for a good 2 minutes. Especially with a patient with bad oral hygiene, sometimes it stings a little bit when they do that, and so they just have it in their mouth for about 10 seconds and they spit it out. That's not going to do. They need to put that in their mouth and swish it around for a good 2 minutes. And then after the Listerine rinse, then I have them brush for 3 minutes. I preferably want them to have an electronic toothbrush or electric toothbrush because that will make it easier for them to do. All they have to do is basically put the toothbrush in the mouth and angle it towards the teeth and the gum line, and it does all the work for them. It also controls how hard they brush and make sure that they don't brush harder than they need to, because if they brush too hard, it'll cause recession and cause sensitivity. And so those are basically the thing. Again, at night, before they go to bed, they need to floss and then use Listerine rinse or use Act rinse for 2 minutes, and then brush for 3 minutes, preferably with electronic toothbrush. in my experience, both personally and in dealing with my patients, people that follow those tips never have a hygiene problem, which makes the treatment all the more smooth and the result all the better. Sometimes we have patients who don't have the best hygiene because they don't follow these tips. And at the end of treatments, their teeth are all straight and the bite is improved and is good. But then they have hygiene problems, and a lot of times when they go to their dentist, they have cavities and dental problems that could easily be avoided by just doing these simple hygiene tips throughout their orthodontic treatment. So that's my tips on hygiene. Look forward to having more of these videos. I hope it was helpful, and have a good day.